I am Payal Banerjee. Today we have with us Dr. Randeep Guleria, a name and a face that needs no introduction. He became a household name during the 2.5 years of the pandemic. A renowned pulmonologist and a former AIIMS director, Dr. Guleria was part of the government's COVID task force and contributed immensely to the handling of the pandemic. He played a pivotal role in designing the clinical treatment protocols for COVID 19 and advised people on drugs and their usage from time to time. As the country is witnessing an uptick in COVID cases again, along with a rise in cases of seasonal influenza, we have Dr. Guleria at PTI to shed light on the current situation. Welcome, Doctor. India is witnessing a rise in cases of H3N2, which is a subtype of seasonal influenza virus for the last 2-3 months. So, doctor, what is this H3N2 virus all about? How does it affect?
So H3N2 is part of the influenza family. Like we had COVID-19, which is part of the coronavirus family. The influenza has been there for a long time. We had an H1N1 pandemic in 1918 also. And therefore this virus has been there, but it keeps changing slightly from H1N1 to H3N2, and the current circulating strain is H3N2. It behaves very similarly to flu-like syndrome, that is, you have fever, cough, sore throat, body aches, and running nose. Your cough can be persistent and troublesome, and in some people, the higher risk group, you may also have a pneumonia which can be more serious and need hospital admissions.
So, who all are at risk and how long can the infection last?
Some individuals, like those who are elderly, whose immunity is low because of age, those who have lungs who are compromised because of chronic respiratory diseases, diabetes with poor control, patients with heart disease, patients who are on chemotherapy and because of that their immunity is low, patients with chronic kidney disease who are on dialysis. So these group of individuals have a chance of getting more severe influenza, that is, the virus can go from your upper airways into your lungs, causing influenza pneumonia, which means that your saturation may fall, your oxygen may become less, and you may need hospital admissions. And if it is very severe, you may land up in an ICU, and then it can also at times be fatal.
Doctor, as the country emerges from the COVID crisis, what are the implications of the H3N2 infections on those who were infected by the coronavirus in the past and on the health scenario in general?
So those who were infected by COVID-19 in the past, by and large, it should not cause a problem because most people had recovered from it and became all right. But we have a small group of people who had COVID-19 which caused lung damage and they had lung fibrosis. So their lungs were already compromised to some extent. And in some people, the immunity is also low. So in this small group of people who've had COVID and have residual effects of COVID, they can again fall in the high risk category and have more severe infection. Now coming to what is the implication of outbreaks like H3N2 as far as the health scenario is concerned. I think it's important for us to understand that when we look at the health system, we're looking at two things. India, we are already having a huge burden as far as health is concerned in hospitals, in ICUs, in the need for beds. And then we have an outbreak where there's a surge in the number of cases. So we need to develop a strategy so that we have a possibility of good outbreak management. At the same time, day-to-day care doesn't suffer. So we saw that in COVID this happened and we need to avoid that. So I think we need to be prepared in 2 or 3 ways. One is an active surveillance so that if there is a surge in number of cases, it could be influenza, it could be COVID, it could be any other new virus. We should be able to pick it up early and say that there is an outbreak that is happening. For that, we need 2 things. One is good laboratory networking, so that if there is a viral outbreak, samples can be sent and you can send and you can pick it up, whether this is H3N2, some other influenza, new variant, or a new COVID variant, or even a new virus. And secondly, a surveillance system which is hospital and clinical based. Suppose in a place you have suddenly a cluster of cases. The doctor or the healthcare worker notices that suddenly a large number of people with a particular type of symptoms are coming. He should immediately report that this may be an outbreak which is developing, so that investigation can be done, it can be managed, and it can be prevented from spreading. And then you have sentinel surveillance, that is, you look at hospital admissions. And if you are not seeing a surge in hospital admissions for a particular illness, then you are comfortable that, okay, you are having cases, but it's not leading to more hospitalization and deaths.
Dr. Guleria, with flu detection rates going up, we are also seeing a consistent increase in cases of COVID for the last 2 weeks. And XBB.1.16 is believed to be driving the current rise. So what is this new variant? Should we be worried?
So we will continue to see new variants. The XBB.1.16 is the new sort of kid on the block, if I may use that terminology. What it basically means is that as the virus evolves over time, and this happens with both COVID and with influenza, the virus will change a little bit, what we call an antigenic drift. It will gradually evolve, mutate a little bit, and new variants will emerge. If you remember, when we had the COVID outbreak, we started off with alpha, beta, delta, gamma, omicron variants. Right. All of these are variants as the virus kept on changing. Luckily, if you look at what has happened in the last, I would say, more than 1 year, we've had variants which are basically sub-lineages of omicron only. So to some extent, it seems the virus has stabilized a little bit. It's not changing as rapidly it was in the past, that you had alpha, then suddenly you had a delta variant and you had other variants coming up. Now it's all that it has sort of stabilized to omicron, and these are all sub-lineages that we are seeing. None of them is causing severe illness and death. So as long as new variants keep coming, but they don't cause severe illness in the form of hospitalization and deaths, I think it's all right, because this helps in giving some degree of immunity to the population if they get a mild illness and recover from it.
Doctor, do you think XBB.1.16 has the potential to drive a wave of cases or even lead to a significant rise in cases over the next few days?
So you may see a surge in the number of cases, and I feel that we will see cases which are always underreported, because two things have happened. Initially, people were very concerned and were all getting tested. Now, even if you have a flu-like symptoms, most people don't get themselves tested. Some use the rapid antigen test and get themselves tested, but if they're positive, they don't report it. So the number that we are actually reporting may be less than the actual number in the community. So the first thing I'd like to say is that people who test positive should report the data, because that helps policymakers and the government to actually know the number of cases and to take a decision. Secondly, like I said, if you're having more and more cases, even if you're having a surge, as long as it's not translating to more hospitalization, more death, it's quite all right. So we may see a surge in number of cases, but as long as we don't see more hospitalization, as long as we don't see more deaths, I think we should be all right.
Both COVID and seasonal influenza are respiratory ailments and have similar symptoms. So how do we differentiate one from the other?
So all of them come under a broad category of what we call flu-like syndrome. Clinically, it is very difficult to say that this is COVID or this is influenza. The symptoms of fever, cough, body aches, sore throat are very similar, and it's difficult to say that this is COVID and this is influenza or this is some other respiratory viruses. The good thing is the precautions in terms of COVID appropriate behavior will protect you against all these viruses.
So, and if infected, what is the medical course one needs to follow?
So if you're infected, there are 2 or 3 things. One is you don't want to spread the infection to others. So cough etiquettes, if you're coughing, cough into a tissue or into your handkerchief, or if you don't have that, cough into your arm so that you are able to prevent the spread of the virus. Because if you cough without covering your cough, the virus will spread into in the environment, into the air, both in terms of droplet and aerosol, and can cause infection not only to family members but even to co-workers in an office. So wash your hands regularly, avoid going to crowded places. And I think the 2 other important things is that if you have a definite diagnosis, for influenza there is a definite antiviral drug which is available, which we used a lot even during the H1N1 pandemic. At that time, the term that came up, although it is available, but different companies make it in our country. It was by the name of Tamiflu, which is oseltamivir, which is useful against influenza virus. So if you know you have influenza, you can give that drug, especially to the high-risk group, and you just need symptomatic treatment. And finally, if you are at the high risk group, then you have a vaccine which is there for influenza and there is also for COVID. So if you vaccinate yourself both from the influenza point of view and from the COVID point of view, you can protect yourself from getting severe infection and be safe as far as the high risk group is concerned.
Almost a year on, is it time for another precaution dose? What do you think?
So I think as we move forward, we need to, and we talk of precaution dose, we need to have two data sets with us. One is, what is the degree of immunity in the population? Is it waning? Possibly it is, because COVID cases are not as much as we were seeing in the past, but we need more data on that. Secondly, what type of vaccine do we need? Do we need to tweak the vaccine? Currently, the vaccines that we have in India are covering for what was the original strain, the Wuhan strain. After that, we've had so many variants.
Correct.
And therefore, if we have to have a new vaccine, it should cover for the circulating strain like we do for influenza. So if we have to have a new dose of vaccine, a new booster dose, we should be sure that it is going to protect us with from the current circulating strain rather than the old and the emerging variants. So I think what we need to do is research in developing vaccines which will cover not only the current circulating strains, but also be able to cover the emerging variants which may emerge over the next few years.
It has been almost 3 years since the start of the pandemic, and new variants keep appearing. So, how prepared are we to deal with any future challenge?
So I think we are better prepared than we were in the past because we have learned a lot from COVID. The challenge, of course, is that whatever we've learned, we keep implementing that as we move forward, and the memory of COVID becomes, let's say, lesser and lesser. So if you look at the last 23 years, we've had a number of outbreaks, and therefore we should learn from what we've seen in the last 2 decades, that we need to prepare. And the preparedness has to be in the sense of good surveillance, an action plan. So how do we upscale our health facilities, both in terms of human resources and infrastructure? But I think the most important thing is also that it doesn't disrupt the other day-to-day management. One of the sort of, I would say, downside or the collateral damage which we saw in COVID was that a lot of other diseases, cancers, tuberculosis, other infections suffered a lot because the focus was only on managing COVID-19, and we were not able to manage these illnesses in the outbreak. Patients with cancer were scared to come to the hospital, and the cancer which was in the early stage came into an advanced stage. People who had tuberculosis were not being diagnosed at the right time, or treatment was not being provided. So we must develop a strategy where we can manage the outbreak, but at the same time our health systems and planning and policy and programs continue to suffer, continue to work and don't suffer.
Is COVID now endemic?
So in my opinion, COVID has more or less become endemic. We have a good amount of immunity. Cases will continue. It is not a disease which we will say it's going to finish.
It is going to be here.
It is going to be here, and we will continue to have some waves of cases coming and going, but it's not going to cause the type of waves that we saw in the last 2 years. A few cases will be there, and we will have to learn to live with it.
My last question to you, as a doctor, what has COVID taught you?
So COVID has taught me a lot of things. As a doctor who was at the All Institute of Medical Sciences, I think it taught me how to be innovative and how to really take on a challenge when you had no idea of how the future would be. It was also a stressful period. It also made you realize that you have to have a lot of family support, have support of your colleagues to manage a pandemic, and it has to be a teamwork.
Thank you for joining us and answering all our questions.
Thank you for having me. Thank you.